According to the most recent numbers available from Health Canada, Saskatchewan First Nations have an infection rate that is 11 times higher than the national rate. Some individual reserves have rates that are even higher than that. An infectious disease specialist who runs clinics in Saskatchewan on First Nations says this is a crisis. She tells us that some people aren't learning of their infection until it's too late, and then they end up dying of AIDS-related illnesses.
Those are incident rates that are equivalent to an African country such as Nigeria. So I was really shocked.
So why are the rates so high? Well, that's because IV drug abuse is very prevalent on many reserves in Saskatchewan, and many people are sharing needles, so they're passing on the infection. One HIV patient that we spoke with said the epidemic is sweeping through whole families and communities.
If you don't have it, you know someone does, someone in your family does, someone in your cousins or your nephews or nieces.
Now, everyone does seem to agree that what's needed right now is widespread testing on reserves where there's a significant risk of HIV. They say this is urgent because the problem is almost certainly worse than what officials have identified so far. But right now, that widespread testing is not happening.
Not every community is willing and ready to offer that testing. So we go where you find an open door and you find the leadership open to that.
The infectious disease specialist we talked to says Health Canada is not being aggressive enough, isn't treating this problem with enough urgency in her mind. She says if widespread testing doesn't happen immediately, the infections will continue to spread and more people will die. Jeff Leo, CBC News, Regina.